The Senate will please come to order. I would ask that all members please take their seats. And I'll ask the clerk to please unlock the machine for the purpose of recording attendance. While we're waiting, I want to thank Senator Anademario for the mask. Thank you, Alana. If all members have recorded their attendance, the clerk will please lock the machine. There are 34 members present. I call on Senator Goodwin. Senator Goodwin. Senator Goodwin moves to adjourn last Tuesday's legislative session. All those in favor, please indicate by saying aye. Those opposed, nay. The ayes have it. Last Tuesday's session stands adjourned. I'll ask the clerk to open the machine again for recording of attendance for today. If all members have recorded their attendance, the clerk will please lock the machine. There are 35 members present. There is a quorum. I ask all the members and their guests to please rise for the invocation and pledge of allegiance to be led today by Senator Sandra C. Cano, representing the city of Pawtucket. Madam Chair.
Thank you, Mr. President. Dear Lord, as senators, we have great responsibility to our constituents. Help us to emulate your example of patience, respect, and kindness to all, as we strive to solve the problems and improve the lives of those we serve. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Senator Cano. There is no journal today. Next order of business is committee reports and communications. From Her Excellency the Governor, the following appointments with the request that the Senate grant its advice and consent. To the State Retirement Board, the reappointment of Gene Rondo. To the Rhode Island Convention Center Authority, the appointment of Peter Mancini. To the Rhode Island Housing and Mortgage Finance Corporation, the reappointment of Nick Racinas, Maria Barry, and Steve McAllister II. To the Rhode Island Infrastructure Bank, the reappointment of Scott LaJoy and Joshua Celeste Esquire. All those go to the Senate Committee on Finance. To the Personnel Appeals Board, the reappointment of William Fascenta. To the Rhode Island State Labor Relations Board, the reappointment of Stan Israel and Scott Duhamel. To the Rhode Island Governor's Workforce Board, the appointment of Mark Amato and Janet Raymond. The reappointment of Michael Gray, Robin Coyer, Steve Kitchen, George Nee, and Jordan Boslago. All to the Senate Committee on Labor. To the Rhode Island Public Transit Authority Board of Directors, the appointment of Marcy Reyes. To the Senate Committee, that goes to the Senate Committee on Housing and Municipal Government. To the Coastal Resource Management Council, the reappointment of Jennifer R. Cervenka as the chair. Raymond Coyer, Donald Gomez, Jerry Sahajian. To the Narragansett Bay Commission, the appointment of Ernest Almonte. To the Rhode Island Resource Recovery Corporation, the reappointment of Michael Sabatoni. All those go to the Senate Committee on Environment and Agriculture. To the Rhode Island Board of Education, Council on Elementary and Secondary Education, the reappointment of Karen Davis, Colleen A. Callahan, and Lawrence E. Pertel. To the Rhode Island Board of Education, Council on Post-Secondary Education, the reappointment of Michael Mello. All those go to the Senate Committee on Education. To the Rhode Island Airport Corporation, the reappointment of Michael Trafficante and Gregory Pizzuti. Those go to the Senate Committee on Judiciary. To the Quonset Development Corporation, the reappointment of Susan Leach de Blasio. To the Rhode Island Commerce Corporation, the appointment of William Stone. The reappointment of Carl Wadenston and Jason Kelly. All those go to the Senate Committee on Commerce. Are there any further communications? Thank you. From the Committee on Health and Human Services to the calendar for February 2nd, Senate Bill Number 2 by Senator Goodwin, an act relating to health and safety, nursing home staffing, and quality care. Are there further reports and/or communications? Hearing none. The next order of business is new business. We have a Senate resolution from Senator Jonathan Acosta. A Senate resolution congratulating Jason Carroll on being elected president of the Brown University Undergraduate Council of Students in April of 2020. Senator Acosta. Senator Acosta, would you like the resolution read? Yes. Senator Acosta would like the resolution read. The clerk will please do so.
Senate resolution congratulating Jason Carroll on being elected president of the Brown University Undergraduate Council of Students in April of 2020. Whereas Jason Carroll, a class of 2021 Brown University student from Maryland studying international politics, made history in April of 2020 when he became the first African American to be elected president of the Brown University Undergraduate Council of Students, winning in a landslide victory with 73% of the vote. And whereas as the fall semester began at Brown University, Mr. Carroll exhibited his immense leadership skills by tackling issues related to COVID-19 safety, both on and off the Brown University campus. He publicly expressed concern for not only the Brown University community, but also for the local community, stating that it would be irresponsible for those who do choose to return to campus to act in ways that would endanger the wider community. And whereas Mr. Carroll also asked that the Brown University administration provide more masks to those students living off campus, and stated publicly that he believes the university needs better transportation service and options to get to the testing site at the athletic center on campus where students can be tested twice a week. And whereas this is the kind of leadership and service to others that Mr. Carroll has exhibited his entire life, and it's why he was elected to a position of such importance and why big things are expected of him in the years to come. Now, therefore, be it resolved that this Senate of the State of Rhode Island hereby expresses its congratulations to Mr. Jason Carroll on becoming the first African American to be elected president of the Brown University Undergraduate Council of Students in April of 2020. We further wish him continued success in all his future endeavors. And be it further resolved that the Secretary of State be, and she is hereby authorized and directed to transmit a duly certified copy of this resolution to Mr. Jason Carroll.
Thank you, Mr. Clerk. Senator Acosta.
Thank you, Mr. President. And I just want to say it's a true privilege and a slight embarrassment to celebrate this today. An embarrassment because for one of the oldest institutions in our nation, for this to be the first and for us to continue living through so many firsts in 2021 is slightly frustrating. But Mr. Carroll has demonstrated amazing leadership during this time, and in the seats that we all sit today, we wouldn't be here without experiences like those that Mr. Carroll is currently pursuing and building upon. So I want to thank Brown University, Mr. Carroll, for all his hard work, and the students that have trusted him to lead them during these times. And thank you, all of you, and urge you to please support this resolution. Thank you, sir.
Thank you, Senator Acosta. Senator Acosta moves the resolution. Is there a second? Senator Bayer, Senator McCaffrey, Senator Chacon, Senator Anderson, Senator DeMario, Senator Lombardi, Senator Coleman, Senator Pearson, Senator Casada, Senator Corkin, Senator Bell, Senator Murray, Senator Valverde, Senator Oyer, Senator Cano, Senator Mendes, Senator Lombardo, Senator Sosnowski, Senator Burke, Senator Paolino, Senator Raptakis, Senator Lawson, Senator Felag, Senator Coleman, Senator Casada. And I think that covers it. Is there discussion on the resolution? Hearing none, those in support of the resolution, please indicate by saying aye. Those opposed, nay. The ayes have it. The resolution passes. We now go to the consent calendar. Senator McCaffrey moves the consent calendar, seconded by Senator De La Cruz. The clerk will please unlock the machine. Senator Coyne, are you voting on this? You're voting for it? Senator Coyne is voting in the aye. If all members have cast their votes, the clerk will lock the machine. There are 35 votes in the affirmative, none in the negative, and the consent calendar is adopted. That brings us to today's regular calendar. I call on Senator Goodwin.
Thank you, Mr. President. We have one adjustment to today's Senate calendar. Without objection, may we take item number 2 and recommit that to the Committee on HEW.
Senator Goodwin moves that we commit item number 2, Senate Bill 4, Sub A, back to the Committee on Health and Human Services. Hearing no objection, so ordered.
Thank you.
That brings us to item number 1 on today's calendar, Senate Bill number 3, by Senator Sosnowski, an act relating to insurance, accident, and sickness insurance policies. Madam Chair.
Thank you, Mr. President, and ladies and gentlemen of the Senate. This legislation has passed the Senate for the past 8 years, and I appreciate Chairman Miller, the Senate leadership, and members of the Senate for their overwhelming support of this measure in the past. Here we are in 2021. With another opportunity to address this issue once again. This bill will prohibit health insurance companies from charging higher premium rates based on the gender of the individual policyholder, enrollee, subscriber, or member. Women have long been required to pay more than men for similar services and products, not just health insurance. Equal rights mean equal costs as well as equal pay. It is unacceptable that in 2021, we could allow providers to charge different premiums on the basis of a person's gender. Women are sometimes charged 10% to 25% to 50% more than men for insurance providing identical coverage, especially during the age bracket associated with childbearing years. Late last year, the governor amended her budget to include this legislation. And I'm thankful for the governor's amendment, and I was optimistic, as I think we all were, that we could get this passed in that budget. But as we know, due to the COVID-19 crisis, the budget was trimmed down, and we passed it without any significant policy changes. But here we are now with the opportunity, once again, and Mr. President, I thank you very much for bringing this bill before the full Senate so early in the session for consideration. And with that, I move passage.
Senator Sosnowski moves passage of the act. Is there a second? Seconded by Senator McCaffrey, Senator Goodwin, Senator Gallo, Senator Anderson, Senator Lombardo, Senator DeMario, Senator Acosta, Senator Corkin, Senator Bell, Senator Aptakis, Senator Valverde, Senator Murray, Senator Oyer, Senator Seveny, Senator Lawson, Senator Coleman, Senator Felag, Senator Mendes, Senator Chacon, Senator Lombardo, Senator Burke, Senator Cano. Senator Chacon, your light was lit before. Was it? Nope. Is it Senator Casada, Senator Coyne, Senator Miller, Senator Pearson, Senator Lombardi, Senator Coleman, Senator Miller. Is there discussion on the act? Hearing none, the clerk will please unlock the machine. Have all members cast their vote? The clerk will lock the machine. There are 35 votes in the affirmative, none in the negative, and the act passes. Item number 3 on today's calendar is Senate Bill 5, number 5, Sub A, by Senator Miller, an act relating to insurance, individual health insurance coverage. Chairman Miller.
First, I would like to thank both the leadership and the governor for prioritizing this legislation over the last few years and including it as a budget article in the last 2 budgets. We were asked to not only prioritize bills in health and human services that were heard in previous years and passed in previous years, but also to prioritize bills that had a COVID-19 factor in them and were important to the pandemic and pandemic remediation. This legislation, in codifying much of the ACA, is important for that effort, in that quality of insurance is as important before, during, and after a pandemic as anything else we could do as a body. This bill mirrors the 2020 budget article, and this bill would codify portions of the federal Affordable Care Act into Rhode Island law. Passage of this bill into state law is extremely important due to the undetermined future of the federal Affordable Care Act based on the potential Supreme Court intervention. The bill safeguards important consumer protections that many Rhode Islanders have become accustomed to, including protections against pre-existing condition exclusions, guaranteed issue and renewability. A consumer cannot be denied a policy even if they are sick. The essential health benefits that I will go over, preventative services of coverages with no cost sharing for individual and small and large groups. This bill does not exceed the ACA, require new state funding or increase premium costs from current levels, include Medicaid, or impose new impacts on businesses. Essential health benefits that this preserves includes ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive services, wellness services, and chronic disease management, pediatric services, including oral and vision care. The Sub-A has a technical change that deals with open enrollment. As many of us know, it was restricted under the Trump administration, and this allows for that extended open enrollment that we traditionally saw in the ACA and in Rhode Island. Consequently, it occurs on page 4, lines 23 for 29. I move passage.
Senator Miller moves passage of the act. Is there a second? Seconded by Leader McCaffrey, Senator Goodwin, Senator Gallo, Senator Chacon, Senator Sosnowski, Senator Cano, Senator Bell, Senator Raptakis, Senator Murray, Senator Valverde, Senator Coyne, Senator Seveny, Senator Oyer, Senator Murray, Senator Corman, Senator Lawson, Senator Sosnowski, Senator Chacon, Senator Gallo, Senator DeMario, Senator Casada, Senator Pearson, Senator Burke, Senator Corkin, Senator Bell, Senator DeMario, Senator Mendes, Senator Sosnowski, Senator Coyne, Senator Casada. Is there discussion on the act? Senator Mendes.
Thank you to this body for this moment. I just wanted to address the fact that I do support and appreciate all of the work that went into this sub-A, 5A. I did want to mention that although I will be supporting this, that there is one important thing that is not in this current bill. There is an aspect of it that does require that there are caps, annual and lifetime caps. There's illnesses that require expenses and ongoing surgery. We just heard a list of them right now. And we know that people are experiencing medical expenses like never before. I appreciate that this piece of legislation will attempt to protect them, but without addressing the fact that there's no prohibitions on annual and lifetime caps, I do not feel that people are fully protected in the way that they deserve. The only justification for annual and lifetime caps being permitted is to protect the profit of health insurance companies. And given that they had enjoyed record profits, I do feel that that is an aspect that should be included in this piece of legislation. I support it, but I support the people that are currently in desperate need of this protection, and I feel that this bill can be stronger. With that, thank you.
And thanks, Senator Mendes. Senator Miller.
Yeah, I'd just like to briefly respond to that. And this is a very important component of the ACA, and there has been legislation previously and will be reintroduced this year to codify, as in the ACA, the lifetime and annual limits. It's important enough that it's actually been introduced by Senator Goodwin and others in past years, and it will be reintroduced, as far as I know. I'm confident it will be reintroduced as separate legislation this year also.
Thanks, Senator Miller. Further discussion on the act? Senator Bell.
Thank you so much, Chairman, for all your incredible work on this legislation. It is an incredibly important piece of legislation, and I will be voting in support of it. It is incredibly important that we provide these protections. However, we did hear in committee concerns about this really important provision being left out, particularly from, I think, the cancer community. It is important legislation. Leaving it in a separate bill, raises the question of whether that separate bill will actually get passed. Because it's one thing to have a bill, it's another thing to pass it, as I think we all know. So I'm wondering if someone from the leadership, and I'll defer to the leader here, but if the leader believes someone else would be the appropriate person to answer, that's okay, would yield to a question about whether they expect this bill to be called for a vote in the full Senate. Would the leader yield?
Senator Bell, who are you asking the question of?
Our Democratic leader, the majority leader, Senator Michael McCaffrey of Warwick. Our Republican leader is not here today. But in general, when I say the leader, I do default towards assuming the majority leader, but I'll try and be clearer on that in the future. You know, sometimes we do have a Republican Party, and I guess maybe I occasionally forget that, but.
Well, Senator Bell, Senator Miller is the floor manager and the sponsor of the legislation. I think the question would be more accurately provided to him rather than the majority leader.
Well, I would be happy to yield to your discretion on that, Mr. President, so I'll ask instead the chairman if he would yield.
Chairman Miller, are you willing to entertain a question?
Yes, I believe in the past 2 years, the separate legislation has been introduced and passed. Last year, it was Senator Goodwin's legislation. She is, as far as I know, fully intending to reintroduce it this year. Whether she does the favor of giving it to another senator or not, I don't know. I mean, that's her discretion. But we, as I previously stated, and I think it should be taken very clearly as the importance to not only myself, but many of the senators, that one of the reasons it is a separate piece of legislation is because of the importance of that part of the ACA, and it gets a separate hearing so that we all hear how critically important that component of the ACA is individually and separately. And it's an important effort and an important hearing, and it should have its own position in the committee and on the Senate floor.
Thank you, Senator Miller.
So just as a clarification, Chairman, it is your expectation that likely we will be passing this second piece of legislation?
To look back historically, it's had it was an easy effort to have it understood and passed in previous years.
Excellent. Thank you so much, Chairman, and I hope that we can look forward towards passing not just this underlying bill, but also Senator Goodwin's excellent legislation on lifetime caps.
Thank you, Senator Bell. Further discussion on the act. Senator De La Cruz.
Thank you. I have a question for the sponsor, if he would yield. I received a flurry of emails today before coming to committee, and my constituents had asked, is this state law that, I'm trying to read the email here, give me 1 second as I can look it up. Does it mandate a contraceptive mandate that the Little Sisters of the Poor have been fighting against for the past 10 years?
Only to the extent that it occurs in the ACA and no further.
Thank you.
Thank you, Senator. Thank you, Mr. Chairman. Senator Palmer.
Mr. President, if I could be recorded in the affirmative on item 1 and 3, I think I have malfunction on my buttons. It was an operator error.
Well, we haven't voted on item number. We haven't voted on item number 3. We have voted on item number 1. You would like to be recorded in the affirmative on item number 1, Senator?
No, seconding it.
Seconding.
Yes.
Senator Palmer wants to be recorded as seconding item number 1 and seconding item number 2. I'm sorry, item number 3. Hearing no objection, so ordered. Is there further discussion on the act? Hearing none, the clerk will please unlock the machine. If all members have recorded their vote, the clerk will lock the machine. There were 31 yeas and 4 nays, and the act passes. That concludes today's calendar. We now revert to announcements. Senator De La Cruz.
May I please be recorded in the affirmative on the vote that I missed?
I'm sorry, Senator?
May I please be recorded in the affirmative on the vote that I missed?
Is that item number 1, Senator?
I believe it was, yeah.
Senator De La Cruz requests that she be recorded in the affirmative on item number 1. It does not change the outcome. So ordered. Senator Felag.
Yes, Mr. President. Announcement, please.
Please proceed, Senator.
The Senate Finance Committee will be meeting virtually Thursday at 4 p.m., so your prompt login virtual attendance would be greatly appreciated. Thank you.
Thank you, Mr. Chairman. Are there further announcements? Hearing none, is there an objection to transmitting adopted resolutions to the Honorable Secretary of State? All matters passed by the Senate to the Honorable House of Representatives, and all matters passed in concurrence to Her Excellency, the Governor. Hearing none, so ordered. The desk is now clear of business. I call on Senator Goodwin for the purpose of adjournment.
Thank you, Mr. President. I have one announcement. For the freshman senators, I'm going to ask them that they check their emails for LexisNexis updates. That should be forthcoming if they're not already here. And next, Mr. President, I will move that the Senate stand in recess so that we can continue to receive committee appointments and committee reports. So, Mr. President, if there's no further business to come before the Senate this afternoon, I move that the Senate stand in recess.
Senator Goodwin moves that the Senate stand in recess and thus be open for appointments and any other businesses that comes before it. All of those in favor of adjournment, please say aye. Those opposed, nay. The ayes have it. The Senate stands adjourned.